bed burn unit. And that was last week, and I was just, I think if we bring something like that, we teleport it to Sierra Leone. I think what I'm saying is I am inspired by what I saw, and I think right now there's a clarion call for us to build those capabilities in Sierra Leone, and we'll work very, very hard to make that possible going forward. In general, for all of these things, there are three major domains that you look at. First, the physical infrastructure. We want to be sure that you have the physical infrastructure that will address these issues in a systemic way. Second is the personnel, the complement of personnel that you need, the doctors, the nurses, the specialties and subspecialties that you need in these facilities. Third is the equipment and the drugs. I think we're going to try to use this situation to be able to build those capacities in the country. The DNA test and victims, the DNA testing is a very complex process. These bodies were charged, but the DNA still remains active. If you go into deep tissue, if you go into bones, if you go into cartilage, the DNA is still there. So I think what we've been doing is collect these kinds of samples so that you can do the whole sequence, or as much of the sequence as possible. And what you do is you try to see relatives, people who are related to that individual. The DNA will be very close to each other. It will be 90, 95, 98%. If you're not related to this person, your DNA homology will be 20% or 15%. So based on that, we can really narrow the familial relationship between these people that passed away and their relatives. So it's important, your role as a journalist here is to really encourage people to come out and register at the disaster management place and be able to give small samples. The sample that will be collected will be just a small swab that you put in your mouth, and we collect a small sample that way. It's very, very simple and easy to do. It's important that your blood relatives, not your friend, because your friend, your DNA will not be the same. We're looking for more mothers, sisters or siblings who are close to this person so that you have a good match. So it's a deliberate, long process of making that happen. We're building capabilities here in Sierra Leone for that. We don't have that here now. I mean, even in the world, it's very hard to get this kind of expertise. So what we're doing is we're working with colleagues overseas, even as we build those abilities here in the US. The last is just the question about insurance as well. I think it's important that we understand what happened in the incident. We are medical people. We don't investigate these kinds of things from a criminal standpoint or a technical standpoint. We'll defer to CID, we'll defer to police to do that investigation, and probably they will help guide as to what the compensation issues are following the accident. I'll try to stop it, but
Yes, Director General.
sorry.
No, you want to answer that?
I just wanted to thank you very much. In terms of the number of children, we've registered 3 for now, and amongst them we've not been able to see any death. They recovered. We had 2 who went home, and 1 was at the Connaught Hospital. In terms of the capacity, we have surgeons who are now specialized as plastic surgeons in country, Sierra Leoneans. We have 2 of them, and who have been leading this drive. If they were not around, it would have also been a catastrophe, because they organized immediately and knew what to do, and were able to, through their expertise, save a lot of lives. Of course, what the minister is saying that we need to add on that. We need more specialized nurses, we need more capacity in that area, but we have people on the ground who are doing the work. And now, recently we had an engagement with WHO. They are trying to help us to establish a bonds unit. So the engagement has already started. I thank you.
DG?
Thank you very much for your questions. I will start, and then my colleagues will also make some comments. There is this question that our concentration is more on response rather than mitigation. I think I went through in the presentation I did. I told you of some of the mitigation activities we have been taking, except if maybe you misconstrued what I said. But a lot of mitigation is going on. And because these mitigations have not gone into full-blown disasters, that is why some people will say the NDMA is not doing anything, you know. But a lot of mitigation activities are going on. And the director of mitigation and preparedness will say some things on that, so that he tells you what and what we are doing or what we have been doing. But it was part of the question that we came here for. And I think I explained that. I don't want to go over all the mitigation activities we are taking. Honestly, one of the biggest challenges we face as an agency is the stubbornness of people. People are very, very stubborn. I'll tell you, when our team went to Angola town, where they were doing something with the bridge, you know. In fact, they had to leave the place hurriedly and seek police protection. The other day, we went in there with the police and the military. That was when they realized that it was serious and that we have the mandate to stop them from doing what they were doing, and it was stopped. We have to change our attitude. If we don't change our attitude, this country is a country prone to disasters. And naturally, we all know it is tough. Tough in the sense that we don't have everything. So if we continue to get these disasters, it takes us more into poverty. It draws us more into poverty. But the officer will say something, the director will say something on that. The findings on the cause of the accident. You know, there are so many explanations because we were not there when it happened. We were only called in when the disaster had occurred. I believe because they were benefiting from what they were doing. Nobody will call you when it is benefiting, but when trouble is there now, they will now call you. But of all the explanations we've got, the one that I think makes some sense to me is the one where one of the, I think the driver's mate or the apprentice, you know, because of the truck that hit the tanker, they said it was still on, the engine was on. So what he did was to put the engine off, sensing the danger associated with the engine being on and fuel dripping out and people rushing to collect fuel. He wanted to put the engine off. And the only sensible thought that came to him was to disconnect the battery. Honestly, if you look at him, you want to say the idea behind him going there to disconnect the battery was heroic. He wanted to save the situation. Rather unfortunately, when he did that, I think there was a spark, and that was what created the fire. Others said somebody was smoking, and he said, oh, but ideally, honestly, where people are cutting fuel, I don't think anybody will go there with cigarettes. I see that one very difficult. So that was why, that was the individual that was under the truck. Because if you had to go and disconnect the battery, you had to go under the truck. And that was why he was not at the side of where the leakage was, where the crowd was taking the fuel from. He was at the side of where the truck hits the tanker. And people were collecting fuel from the other end, you know. So I will understand if his child body was found under the truck. But probably that was where he got his own calamity. So I think that is the only one that makes some sense to me at this stage, except if others come up later, you know. Okay, I think I will allow Mr. Bangura. You want to talk something on the issue of the same theory, the same bureaucracy. Nobody prepares for. Okay, nobody prepares for disasters like this. This was an accident that led to this sort of disaster, you know. And ideally, you do mitigation, you do a lot of education, public sensitization and that kind of stuff. But you cannot determine what type of incident that will lead to a disaster. It is very, very tough. I think I'll give my deputy director the floor to make some comments. Yes, Mr. Readers.
Thank you very much, DG. Just a few quick points for the attention of this gathering. Somebody asked a very sensitive question. What strategies are we using to ensure that we are able to address the challenges that we are faced with our current disaster management arrangement? I'll go straight to the point. The first strategy is making sure that we do comprehensive assessment of hazards, vulnerability, and risk, and ensure that we do risk mapping, indexing, analysis, and interpretation. Because when you have knowledge with respect to risk mapping, indexing, analysis, and interpretation, we give you the upper hand to be able to ensure that you streamline the kind of engagement that you put in place for effective management of disaster or mitigation. The second point is, quite very often we do simulation drills to ensure that we're able to be on top. There may be two types of drills that we are talking about. Either we do a field drill or we do a tabletop drill. A tabletop drill, you bring the necessary players to a table, making sure that we give them mock exercises for them to see, one, the plans, the standard operating procedures, and the other instruments that we have developed over time to be able to put them to a test. And where there are weaknesses, you are able to correct them. In the field drill, it carries a lot of resources that require a lot of exercises. So that's the second point. The third point is, we must be in position to ensure that we enhance knowledge management of our population. Very often, we are faced with a very vulnerable public. Some members of the public do not understand the relationship between a tree that's allowed to grow into a mature tree and prevent windstorm disaster over a period of 40 years. But it takes a very reckless person, very open society, only a period of 2 or 3 hours to cut a particular tree and expose the population to the risk of windstorm. And that's what we're experiencing in many parts of the country these days, in which the DG referenced that some parts of the country, up country, we are faced with windstorm disaster. Over the 92 disaster he referenced, a large number of that, 2/3 of that are windstorm disaster. But we are taking a cue and we are learning from the experiences and we want to ensure that we are able to prevent the challenge. The third point is to enhance our early warning system. Already he made reference to the very point that over time, the AFICED network will be able to assist the National Disaster Management Agency and by extension, government, with a number which is 1199 to be able to reach out to the public. We also want to ensure that the other mobile networks companies in the country are able to emulate the example and ensure that we are able to spread the net, so that at the end of the day, when events happen, we'll have many ways in which we are able to connect to the public. The third point is making sure that we provide education for the population, so that they are able to understand clearly the nexus between human security and environmental security. At the end of the day, when that is in place, then we are able to ensure that we are able to protect the population. And the last point I want to make mention here is the issue that is dealing with how we are able to rationalize risk, vulnerability, and hazards to the point of ensuring that we are able to develop the necessary documentation, the standard operating procedure, the plans that will help us in order to streamline our activities with respect to disaster risk management. Thank you very much, Director.
All right, thank you very much.
Mr. Ban, added to that is this research work. This research work is on the vulnerabilities this country is faced with. So if we solve the problems as identified in this research work, we will do a lot of mitigation and we'll have the chances of reducing the disasters. There are some disasters you cannot control, but however, you may reduce the effect of that disaster. And my friend, with the issue of the languages, we have started. We have a book here in 5 languages. We intend to continue with it, so that all the local languages are involved. And with that, we can easily pass messages to educate the population on what is good and what is bad. We don't want to learn experiences from what happened with, at Wellington. I had a story the other day that there was a tanker that had some starting problem around that same area, maybe further towards the junction at PMB. And then the driver said, okay, let me wash the battery terminals so that they can fire well. In the process of doing that, people started seeing water coming from the tanker and people were taking to their heels. Another tanker is making fear. We don't want that kind of experience. We don't want that kind of education that comes out of suffering. No, we will educate, we'll do community engagement. We'll continue with our community engagement. And Director Ban, since he came in, we've been doing a lot in the various languages, but specifically actually Creole and English. And we have intention to discuss this book with the Minister of Education, so that probably we look at bringing issues of disaster mitigation in our schools, in our school curriculum, so that from the early age we start learning about it, as our parents used to do, or before you have all kinds of advertisements on radio, especially when the road signs were changed from right hand to left hand, look left, look right, look left again before you cross. We've made it basic so that people start learning about these things from the early age, and then they'll grow up with it.
All right, thank you very much. I think I just need to make an addendum with reference to your question as to what actually is the cause. With reference to what DG said, I also want to draw your attention to the fact that there was a state address by the president that he is going to ensure that there's going to be a committee constituted to look at that. Yes. Because all that we are getting now, those accounts are eyewitnesses, video footages prior to the explosion. They are unverifiable, so we cannot verify them. So please, we urge you to wait for the actual report that will emanate from that committee that will be constituted, please. Thank you. Okay, the next 5 sets. All right, go on.
I'm Dunstan Goma, Houston newspaper. And my question is for Dr. Kaba. Dr. Kaba, your full name, please, and I need more detail on the 9-year-old child that donated to fire victim. In monetary terms, what was the amount? And my second question is to the Director General. With a military background, sir, what should have been the intervention of the military engineering unit at the Wellington Junction? There is a military engineering unit. From that of your background, what do you think they should have done before the presence of the police?
All right, the next question. No. Ask for this first.
Something like a follow-up.
No. Let the chancellor please. Yes, go on.
Hello. I'm Bawadan Kamara, right for New Citizen newspaper. So my first question here is for the Minister of Health. There is a popular opinion that the number of casualties, right, the people who died in the fire incident, is being suppressed for whatever reason. What's your reaction to that? And secondly, the issue of one of the challenges you stated earlier on is that there is no blood bank in the country overall, right? For emergency cases. Initially, people were donating blood, but people have to stop because they are donating the blood while the nurses are sending this blood to patients. So, what do you think needs to be done to reassure the public that once they donate blood, the blood will be given to the patient free of charge? And to the Director General of the NDMA. To the Director General of NDMA. Yeah. One of the work that you are doing to try to track the people who are directly involved in the incident. What are the challenges that you are facing? And secondly,
okay. All right. Perhaps, yes, why do you think? Of course, I think we have recorded the first aspect of the question. Fire, go on.
Yeah, thank you very much. Fire, Amara Fire, Benjamin. To the Director of National Disaster Management, it's becoming fashionable that right across the nation now, entertainment places, filling stations are being turned into entertainment places. Bo, Kenema, and many other places. What is your institution doing to ensure we do not have disaster as a result of those things? Thank you very much.
All right, okay, the last one for...
Prince Obaka Williams, to my credit, to the Director National Disaster Management Agency. I want to know if there are laws being put in place for people who cut down trees that are supposed to manage the ecosystem, and if there are laws, what are the penalties for people who cut down trees that are supposed to manage the ecosystem?
All right, okay. I think that is that. So we start with the, what again? You asked the question, what is it?
Again, Omelami Banya from AYV. Thank you, Mr. Minister, for charging us as journalists to ask radical questions. It's rather unfortunate. The incident manager at Connaught, I was at Connaught a while ago. That's why I did ask how many kids so far got involved in this fire incident. I went there, I saw 3 kids currently admitted at Connaught Hospital. But he said that there is only one at the moment. And also, there is no blood bank in Sierra Leone for you, Dr. Debbie. There is no blood bank in Sierra Leone. Also, no specialized bond units in the country. And also, I refer to NDMA. Again, from what I heard from the testimony, the accident happened something like 30 minutes, and the tanker driver took a megaphone. He was asking people to go off the tank, but people failed to adhere to what he was saying, which led to many people to lose their life. In some other countries, we've seen people or presidents, ministers resign because they fail the nation. 3 of you, don't you think this can happen in Africa?
That's the last and final question, because I actually think we should actually elevate such gatherings. We are here to ensure that we respond to questions and, of course, update the public with regards to our activities. And I think we owe that, and we should treat that with seriousness when we're here. I think the minister, the director general, left their busy schedules to ensure, because they think it's an obligation for them to update the public. So over here, I think it's important that we respect each other and that we treat the business that we're here for very seriously. We go straight to the DG. I think you need to take the first shot now.
Good, yes. Mr. Bangra will talk on the issue of filling stations being turned into entertainment places. Yes, Director. Sorry. No, it's not.
Yeah. In regards to this particular question, what we will say here is preventing disasters is going to be a community involvement. We move around, we see the disasters or the risks that we are working in. Like Fire rightly said, it was when the accident at Wellington happened. As when we walk around now, I look at fuel stations and ask myself the simple question: if this fuel station catches fire, how many houses will be burned in this one? As an agency, we are collecting data, and what we are going to do is to work with the first estate, especially the media, for us to make this data available to people about the disasters and the risks they are exposed to. We had a flood season between August and September, and we were anticipating floods. Interestingly, we had more fires than floods. When you are walking around, you will not get that one. But as an agency, when we collected all the data and did the analysis, we noticed that in between June and August, we had 29 fires and 3 floods. That was because previously we were anticipating floods, and the government did the right thing by using a new strategy of SLRE, giving contracts to people to actually clean the gutters and then hold on to give them the contract until the rest of the season. So when you are giving, for instance, a portion of the road that is usually flooded, when you clean it, the army comes and supervises and see that it's okay. They will follow up on that gutter anytime it's filled. So if you notice, Freetown did not have much floods this year, but we had more fire accidents. November, December, January usually is a period of bushfires up country. and we are planning sensitization in those communities on how to prevent fire. Like the DG said, it's not that we are not doing things to protect citizens, but most of the times we only remember the disasters that happen. Like we have engaged all the coastal communities with UNDP on coastal erosion and prevention of the coastal communities against sea level rise, because we are anticipating that this year. But nothing happened there, so there is no way we can actually report that one for now. If one community had drowned because of flood, then everybody will say the agency is not doing something. We understand that part. What we are going to do is to work with the media. Work with the media in a sense, we collect the data, we analyze the data and make it available to you so that you can give it to this community so that people can know the risks and the vulnerabilities they are exposed to. I thank you very much.
All right.
Okay, no, we are not done. We are not done. There are issues to answer. Intervention of the military engineering unit that you said is located there. For your information, that location is no longer occupied by the military. So there was no military establishment there. I spoke with the Chief of Defense Staff and he said they had closed that outfit. In the first place, it was not even an engineering unit. It was a quick reaction force. We had two locations for quick reaction forces, one in the west and one in the east. That was to aid us in case there are problems for quick response. It's no longer located there. So that one is out of the military, please. Okay. And with the issue of the challenges related to track people, contact tracing, it has started, we are on it, we are getting the details, but honestly, as I said earlier, the attitude of the Sierra Leonean, we have started seeing on social media, people telling their relations, avoid WhatsApp, Facebook. Avoid Facebook, your face should not, delete your face from Facebook, because we are going to register your name. So until they come, things that they come, you know, that's very dishonest in the first place. We have to, you know, His Excellency said, let us use this as a means to bring us together so that we treat issues with the seriousness they deserve. Somebody was saying the driver was on megaphone announcing for people to leave then it's lawlessness. No, it's a simple lawlessness. Honestly, we all feel for what has happened. It is a very bad strategy, but it is a human-induced disaster. That is a human-induced disaster. Had people not gone there to scoop fear, honestly, it would not have happened. It will not have happened. That is what we call human-induced disaster. And we did everything humanly possible to reduce or to put out that fire, because we called the fire force, we called the ambulance services, we were there until the last body was taken from that spot. And in fact, when that incident happened on Friday, I did not get sleep until Sunday before I got 2 hours sleep, and then I was up again. So the disaster agency, the medical team, they did extremely well. You have heard that even people that were on leave, they came back to the hospital to work. And the minister has said some people are only getting 2 hours sleep a day. You know, I think we must appreciate the effort of people, you know. But if you say for every occurrence people will resign, then people will resign every day. But occurrences will happen, things will happen, you know. So let us don't judge that kind of thing by saying people should resign, you know. Okay. I think we are all patriotic, we are all doing what we can, you know, to avoid these things happening. But please, we must all put our hands on deck, and you belong to a family, you belong to a community. You also talk. The onus falls on all of us. Let us talk, let us change our attitude. Then I believe we can move forward. So those are the issues.
Right.
Maybe Mr. Rodas will talk about the issue of laws. Sorry. Mr. Rodas, laws on cutting down of trees and the appropriate punitive actions.
Yeah. Ostensibly, we are moving on with respect to trying to modernize the laws that we have on issues related to disaster management and even other ancillary institutions at government exposure. There's a nexus between us and some other institutions at government level. We work very close with the EP, we work very close with the Ministry of Agriculture, we work very close with other state institutions that have a lot to do with the environment. You recall there's a law in this country that dates far back as 1911, which is really anachronistic and outdated, that when you cut a tree, you're going to be fined 5 pence. Meaning that somebody will have the liberty to go and cut trees because he has the capacity or potential to pay you more than 30 or 40 trees. But what I have over time is that with the enactment of the National Disaster Management Agency Act of 2020, there are certain punitive measures to the lives and property of the population. There's an area in that act, and I encourage you all to go back and read.
The casualty numbers, you know, I think that's below the belt. I think it's really important, you as journalists, in these very, very delicate circumstances where people hold on to everything that you say because they expect you to know a little bit more, they expect you to be investigative, to find out more and reflect what's really happening. I think we have to be very mindful with issues like why would anybody in these circumstances want to suppress the numbers? When we had actual graves, when we say we're not going to do any mass burial, we're going to have dignified graves, personalized, respectful burials in a flag draped coffin. So I think things like that, you know, I think you as the media, you really don't want to bring that to attention. I think it's your duty and responsibility to address and dismiss those kinds of falsehoods that are really not grounded in fact. On the more serious issue of blood banks, you know, blood donations are really, really important here. There are several methods of using blood for service delivery. What you have in Sierra Leone is more replacement donors, you know, where in some cases you bring family members or friends or whatever to donate blood so that they will use it and then replace what they have. In a lot of those cases it involves use of blood bags and some other costs that are associated with it. But nobody sells blood. Nobody sells blood at all. If you are buying blood, then it's illegal. So let's look into that and just see how best we could address this, because I think we don't have a national effective blood transfusion service, but in every hospital, major hospital, there's a mini bank, there's a small blood bank where you could donate blood, you keep it refrigerated for a small period of time and use it, in a lot of cases, replacement donors. What our dream is, as the Ministry of Health, is a future that's looking at voluntary, non-remunerable blood transfusion service. That's what we're working on for the whole country. And it's a process. We're making sure we have all of the resources, we have the administrative structure associated with it, we have the regional blocks associated with it, and over time you're going to see a very, very transformed blood transfusion service here. That's not only looking at voluntary donations, but also blood fractionation. So that if you have 1 unit of blood, you could actually break it up. Some people just need the red cells. Some people just need the plasma component of it. Some people just need the platelets components of it. You could take the 1 unit of blood and break it up into multiple fractions that will serve 1 unit of blood may serve 4 or 5 patients. So that's where we're going to. And I think it takes a little bit of organization, it takes a little bit of community engagement to know that the blood that you donate is really in service of others. So I would just say now, let us do all we can to support these people who are in hospital. Let's do a voluntary blood donation. Yesterday, the U.S. Embassy had a blood drive. I think they had like 40 or so units of blood collected there. Others are doing that. That's your own small national service. If I'm not a doctor, I'm not a nurse, I'm not in the disaster management, you ask myself, what am I doing besides feeling sorry? Well, you could pray for them. That's one. The other is you could go donate client blood. And I think if we really mean service, those are good illustrations of service as we build the national blood transfusion service in this country. So please join us in that. And on the resignation piece, I think that's a very important question you asked. I was on a mission in Dakar, Senegal. On the evening of this event, I got the news at about 10 o'clock at night, and since then, I haven't had more than 2 hours of sleep. The fact that you had WHO respond in 24 hours didn't happen by magic. I was on the phone with the WHO Regional Director in Brazzaville, with the WHO Disaster Management Office in Geneva, and in the middle of the night. So by the time they woke up, they started putting systems in place. They had a warehouse in Accra and created an air bridge to move things from Accra quickly into Sierra Leone. The kinds of activities that are going on, like constantly talking to Dr. Kaba, as you said, constantly talking to Dr. Sandy, encouraging the doctors. I mean, we haven't had a minute of sleep. So, usually in those circumstances, what people say is to say thank you, not to say resign. I like to switch jobs with you a little bit. Let me do the reporting and you have the sleepless nights. But anyway, I think these are things that we need to do as one family. I don't feel angry or insulted by that, but we are one family. And let's try to help each other out on these issues.
All right.
I think there was a question.
Yeah,
My full name is Dr. Mustafa Kaba. And in terms of, you asked monetary terms, the contribution the 9-year-old made. I think this one you can get from the secretary at Connaught Hospital. I was just trying to create a scenario so that we understand what we're going to do, right? You can get the details from Connaught Hospital. Yeah? He donated boxes of milk. It was very good as a young Sierra Leone. In terms of figures for Connaught Hospital, I think there is no difference. I said 3, you say 3. Technically, discharged or admitted, the figures keep changing. The situation report I gave is from yesterday. So I'm going to upgrade it to this statistic and inform you accordingly.
Thank you very much. It's how we continue now to this guest briefing. Invite our guests for pictures. Quickly, let it be very, very, very